A time that I went above and beyond was during my externship. I had a patient admitted and when I went in to do his morning assessment, I noticed how uncared for his feet were. And I asked him about it. I said, "How do you usually take care of your feet at home?" And he said he doesn't usually do anything. He lived alone, and the only support that he had was his neighbor who would occasionally go grocery shopping for him. And he actually mentioned that sometimes he clipped his toenails with garden pruning shears. That just caught me off guard. But later on during the day, when I had some downtime, I went into his room. We got him seated in the chair, and I got a bucket of warm, soapy water, and we soaked his feet for a while. And I scrubbed them with washcloths, and there was just a bunch of dead skin and a bunch of stuff that we got off there. And I was in there for probably half an hour. And the whole time we were just chatting with each other, having lighthearted conversation. I could tell he appreciated it. And then I returned, I was doing 3 days in a row. So I came back the next 2 days and I had the same patients. So we repeated this for the next 2 days. And he just expressed to me how happy he was that I did that for him. And I told him the importance of definitely seeing a podiatrist when he was discharged, just because there was definitely something going on. But that was a time that I think I went above and beyond.
Did the doctor know about the fungus and the necrosis and stuff like that?
Yeah, he just said to see a podiatrist outpatient
Oh, okay. So add that in.
about
Um,
like his fluid overload and that sort of stuff, not his
yeah.
feet.
Okay, cool. I mean, the reason that I like it is it really speaks to your integrity. The next, probably most common one they like to ask is a time that you showed compassionate care. They could also say, above and beyond, or a time that you
Hmm.
showed empathy, your most fulfilling moment so far,
Hmm.
something like
Yeah, I have a story that I love to share about this. So it was in the, I had a maternity patient, which was very rare because I had never had a maternity patient on the before. But she had just been, she had a, and when I received her for care, she had just been extubated and was getting ready to actually be discharged because she was stable. But I noticed that she was very solemn and anxious and kept asking about her baby because her baby was actually at the NICU at next door. And so I could tell that she was just very anxious about seeing her baby, but she was about to be transported to the maternity floor at the neighboring hospital. And I had the time this day because I didn't have another patient. So I asked if I could personally wheel her over to the NICU first so that she could meet her baby for the first time. And I got the approval to do that. So I personally escorted her over to the NICU and she got to meet her baby for the first time. And it was just such a special moment. And I felt really lucky to get to be a part of that and witness her holding her baby's hand. And she shed a tear. And it was like a really cute moment. And I think what this taught me is that when I have the time, that it's really important to be attuned to my patient's needs. And I think in that moment, it made a really big difference for her and her family to stop on the way to the maternity floor and give her that time to meet her baby. Because I know that once she gets to the maternity floor, she's going to get carried away with being admitted and all the things that they're going to have to do to get her settled in. And I could just tell it made a big difference for her. And I was very happy to be a part of that moment. And I will always try to find those moments where I can extend compassion for all of my patients.
Yeah, I think that one's good too. My favorite part was when you were talking about being attuned to their needs. I liked that phrase.
Mm.
If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview.
Yeah, I actually have one, and I think one of your videos, someone had something very similar to me, which I thought was kind of cool. So for me, as for a certain sense, I think when I went above and beyond for a patient was during my rotation at school. And this patient, he really seemed distraught, like he really seemed sad. And when I looked into him, I asked him like, was everything okay? And I quickly introduced myself. Like I kind of read up on his chart a little bit before I went in there. And he was just here for I think something was wrong with his abdomen. I think he was lots and he had a lot of abdomen pain. So I asked him, is there anything wrong? Can I do anything to help? And he just really wasn't talking as much. He was nodding here and there. And one thing I noticed was that he had like a picture of his son like on his like like the little tables that they have on the hospitals in the hospitals. And I was trying to make conversation with him, and I was like, "Hey, is that your son?" And then I think at that moment I kind of saw him like open up his eyes and try to talk to me more. And he was like he was saying, "Yeah, that's my son." Like, yesterday was his 22nd birthday. And I was like, oh, so it was your son's birthday. Like, I was like, oh, was it recently your son's birthday? He's like, yeah, but he's with his friends right now traveling across the states. I was like, would you want to see if we can call your son to see if you can wish him a happy birthday or something? Because I think his son wasn't able to talk to him for a couple of days due to like travel. So what we did was I took this situation to my nurse and I was like, hey, I think this patient's kind of like sad right now. I think it has to do with something with his son. And I showed her that picture that I was talking about. And we actually went through like the registration on the chart and we saw that his son's number was actually listed on there. And what we did was we used the hospital phone to like try to call him and we're like, hey, we're calling from this hospital and your dad wants to talk to you about something and want to wish you happy birthday. And eventually we were able to FaceTime him on on our patient's phone. And I think at that moment his mood went up so much better and he really thanked me for just noticing that because he thought that he wasn't going to be able to call his son at all just because, he didn't know if he was allowed to use a phone here because it was his first time at the hospital. And I told him, you're allowed to call anyone here. And if you want to talk to your family members, you can either let us know or if you have anyone else you want to talk to, we're more than happy to help. And I think from that moment, I just realized that just noticing the small details, something that can be easily overlooked, can really help you strengthen your relationship with your patient and just create an environment where they feel welcome, I think.
I love the last like the wrap up for that. I'm trying to remember your wording so I can like use it for the future. The part that was confusing for me was like, wait, so he have his own phone that he could have used, but he didn't want to bother his son, or like his phone was dead, maybe, or like
Yes. So
what?
what happened was his phone, like it was I think it was yeah, it was dead actually. And he didn't have a charger. So
Mm.
luckily the computers that we're using, it was connected to an iPad and it was the same charger for his phone. So
Oh,
I charged his phone and then at that point we checked the numbers on the computer and they matched perfectly with his son's number. So we were able to call him on his phone. And I think when he came in overnight, admission, I think his phone had died and he didn't bring a
yeah,
charger. So that's what happened. And I
yeah.
guess it's more bummed out that he wasn't able to spend it with his kids. He wasn't able to talk to his son about his birthday.